Hello, good evening, everyone. Thank you for joining our special session here today, where we come to learn about COVID and at the same time do some good work to raise funds for MMA Sabah, the Malaysian Medical Association here in Sabah. Today's fundraising session is initiated by Datuk Chua, the developers for Bay Suite here in Likas Bay. He's always been the fastest to respond to the need of the community, from donating masks to raising funds for the frontliners. So Datuk Chua, please say hi to everyone.
Okay. Good evening. Thank you for your support. Together, we can make the impossible possible to flatten the curve again. Thank you.
Great. So next up, let me introduce our special guest. So first up, we have Professor Dr. Kew Seih Teck. He's the head of department and consultant pediatricians at UMS. So Dr. Kew is also the chairperson for MMA Sabah branch, whom we are raising funds for today. So Dr. Kew, say hi to everyone.
Hi, everyone. Good evening.
Good to have you here. And last but not least, we have Dr. Timothy William, who is the infectious disease physician at Gleneagles Hospital here in Kota Kinabalu. So Dr. Timothy, say hi to everyone.
Hi, everyone. Thank you very much. I'm looking forward to having a good discussion with all of you all.
It's great. So if our audience, if you're watching this right now, if you have any questions regarding whether COVID or it's about the donations tonight, please put them in the comment box below. We will pick them up later. And also, please share this session out to your friends and family so more people can come and join and learn, and also to raise funds for the association. So let's dive straight right into it. So Dr. Chua, I'd like to ask you, we've had this discussion earlier, about the situation here in Sabah. So how bad is the situation, the COVID situation here?
Yeah, first of all, I just want to share that for the first MCO in March, we have been helping the frontliners. And then, can I have the first slide, please? On the 9th of March, we have been helping and given 50,000 pieces of latex gloves to the Minister of Health, Datuk Frankie Poon, on the 9th of March. And the second photograph, we have actually also on the 11th. On the 11th, we are actually given to the Assistant Director of Immigration another 31,000 of gloves as well. And then on 6th of May, we are actually giving it directly to Dr. Christina Rundi, the Health Department Director, on behalf of Sharida. So this has been going on for the last MCO 1.0. Now for this 2.0, we are actually giving donation initiative to Dr. Kew on behalf of MMA. And then tonight, we'd like to share also that thank you for Dr. Timothy to come forward to share with his view and advice to us. So nevertheless, we can look at the COVID in Sabah. How bad is it now? Is it very serious? Is it something that it has not peaked yet? As I think as of today, we actually have the Federal Minister announcement saying that the prolong another 2 weeks, I think until 9th of November, I think which is the right decision to make, because the cases that actually gone up today is actually quite terrible in a way that our view is. And then how bad is it? Maybe some of the questions that we actually wonder, it can be tackled and answered by Dr. Timothy. Let's look at the global pandemic at a glance. In the world, if one of you, if some of you are not watching using the computer, you are using a handphone, can I just read the figure to you? In the world, we have about 42 million cases positive, and total death is 1.15 million, and the total recover is 31 million. So this on the world. Number one in the world basically is USA, 8.7 million, and total death is 230,000. It followed up closely by India, 7.8 million, and total death is 117,000. So we look at the, also in the neighbor countries, Indonesia, 385,000, Philippines close behind, 367,000. So this is our neighbor. And we also look at where the original source from, China. They're actually well managed. Total cases 85,000, sorry. And then the new cases only 28. So 54 they are ranking. We look at back in Malaysia, we're actually ranking 89. Malaysia is about 25,700. So we look at ASEAN in the region. How is Malaysia ranking? Malaysia ranking is on the 5th after Indonesia, Philippines, Singapore, Myanmar, and Malaysia, 25,700, which is not too bad. You know, we manage as a country. And then we look at our state in Sabah. Can we have the next slide, please? Okay. So we just clock in the 1st of September. We actually have relative small cases. And now, as it now is,
we're the top in Sabah. We're top in Malaysia.
11,285. We are the champion for the wrong reason. Sorry, folks. This is basically, we try to, what do you call it, get the curve, flatten the curve, okay?
Yeah.
So this is tonight, we are trying to get everybody to work together so that all these cases will actually reduce dramatically. So can I have the next slide? As I compare Sabah state to Malaysia, we have about almost 8,000 cases, and then rest of Malaysia is only 4,005. And based on that population, we have about 204 against 16, about 13 times higher in Sabah. So reported death 63 against 5. So basically, we actually overall the death rate is 7.3 times higher in Sabah. This is actually basically is comparative. We are also the champion for wrong reason. So can I have the next slide, please? This is actually basically also from the MOH. This is just of the highlight that the in 7th October, 91% of unlinked cases, they are not linked to anyone. Like now you have Kebayan, Penjara, that's linked to that prison. It's easier to know where it is come from. So basically this will be going on. I think from now on, basically they know where to trade, but I do not have the latest. Maybe next we can, by end of program, we try to get the latest, if I can get it from the internet. Next, please. Okay, this is something that we have to watch for. If we don't flatten the curve will reach almost 1,009 by end of this month. Okay, 1,009. Because we are actually using the SIR model. Okay, SIR is actually suspected case, infected case, and recovered case. So we use the infected case. This is almost 1,009. So how do we actually do it? How to flatten the curve? And then the orange color is a medium mean, which is the likely case that if we actually flatten it, we get 600. If it's actually lower than that, we'll get the green things, which is about 100 cases. This is actually the MCO, prolonged MCO, we try to reduce to less than 200 cases. Okay, the next slide, please. Okay, flatten the curve. There are a lot of collective action can limit the rise of new COVID infections. As now, basically, we are helping the frontliners, especially the health department, through MAA, by helping hospitals to manage increased demand for care. So this is one of the exercise we are doing. Apart from the SOP that we are doing, social distancing, wearing masks properly, and then 40 days home quarantine if suspected contact, close contact, and personal hygiene, regular hand hygiene by washing, and then use of hand sanitizer, avoiding touching eyes, nose, and mouth. And now we actually have a new conditional movement control, work from home. All these are basically is try to flatten the curve. Of course, we do not want to do it like in Wuhan, whereby they're actually going for total lockdown. That's very aggressive move. We do not want that. And this is the way how we actually approach it. Okay, the next. This is actually what we think that the government or the state government can do to tackle Sabah. As I know that we informed that by the local government that 95% of the hospital bed basically full up, taken up. And some of the positive cases, they actually would advise to stay at home. Which I think that if we have not enough bed, I think no sports complex, Tawau, Sandakan, Ike are full of 300 beds in there. Maybe state government or federal government can allocate budget to turn the idling hotel into temporary quarantine center. Capture on whatever it is. Maybe they have to change the bed. Maybe they have to do a lot of sanitizing before you can take over the beds. This is one of the items that we like to just suggest to government. And then we also have to do a lot of stock up for personal protective equipment, PPE, which I think Dr. Kew is going to buy some for the medical staff. And then for us, we also need to do that as well. Okay. And then the other one is allocate budget to turn the restaurant into quarantine meal catering. We are actually trying to say that in order to build our immune system, the food that taken by the patient, it need to have proper diet. Nutrition from maybe hospital must advise how to do the food and whatnot so that they build up the immune system. This is actually what we suggested. Okay.
Right. So basically, what Datuk Chua just showed us is half of the COVID cases in Malaysia now comes from Sabah.
Yes.
And unfortunately, correct. Our medical frontliners are stressed to the limit. So I think that's what the associations like MMA is trying to do something to help to lighten the load. So maybe I can just ask Dr. Kew, to explain a little bit. Just introduce to us what is MMA and what do they do?
MMA is a Malaysia Medical Association. Is a main representative body for the registered medical doctors in Malaysia, including private and government. All the doctor, general practitioner, specialists all involved, including the medical student. So our headquarters is at the Jalan Pahang, Kuala Lumpur, which is just opposite the General Hospital of Kuala Lumpur. Yeah, you can see the building. So, and each state will have one branch. Yeah, that means in West Malaysia, there's around 11 states. Then there's 11 there, and Sarawak and Sabah. And I'm the one who represent the Sabah state. And so that I can help
all the medical professionals, they join this association, they're members of these associations.
So we help them in a lot of the for their welfare. Yeah. For example, the last time when I start working, before I start working, when you are on call, you don't get any pay. Yeah, it's considered part of your job. Even that even McDonald's, all that got the overtime pay, right? Doctor was no. So then MMA look into this, say no, you must give. And at the time when I work as a internship, I got 20 ringgit per night when I'm on call. That at least better than nothing. So slowly it increased throughout the time. Yeah. So this is what we look after. And then we also do some health promotion, medical volunteer, all this work. Yeah. So when we realize that the problem of the COVID-19 in Sabah is getting worse, so we joined with we contacted the Sabah State Health Care Department, Datuk Dr. Christina Rundi, and the doctors in the hospital. And then we realized that the number of the patients are increasing, and they have to allocate more work for COVID-19. So they shift a lot of the patients out between Elizabeth II. So that's one. But we all started at Tawau, Sempurna, Lahadatuk, and get towards the So with that, we will our foundation. MMA.
I'm sorry, Dr. Kew, your sound is a bit off already. I think maybe Jim can send you the mic, the microphone, the headphones. But meanwhile, while Dr. Kew set up the headphones, Datuk Chua, I understand you are also initiating a fundraising for MMA, for this association.
Yeah.
Why do you want to do this fundraising campaign?
Basically, we are helping the government in a way that to flatten the curve by improving certain SOP and healthcare to the medical frontliner, because you can see the medical frontliners are actually sometimes they're also without the proper equipment, PPE, they're actually down with the infected case. So some of them have to be quarantined for 14 days or whatnot. These are the people, are the frontliner, they are hero. So we must anyway try to help them to set up proper things for them, so that anything of the things that shop equipment, maybe through MMA, we can help them. Because through the trust fund or MMA, I heard that this fund will be basically donated by the public like us, will be actually tax exempted. Yeah.
Tax exempted, so it is a big benefit, also initiative for the corporate to donate. So now that Dr. Q is back with the headsets already, so maybe Dr. Q can briefly tell us how can the public donate to MMA?
Okay, actually, MMA Foundation has set up since March. Yeah, there's about 1.5 million ringgit inside it. So we have requested some equipment from there. But unfortunately, this foundation is actually set up for the whole Malaysia. So we realized that it's not enough for the need of the Sabah at this stage. So that's why we set up another, we got this fundraising. And this one, when you donate, you must write Sabah COVID. So the donation will go into the foundation, but especially will allocate to, is especially allocated to Sabah.
Right.
Yeah. So far, we already got more than 500K. Yeah, and it will be more. And we have already contacted the hospital and to see which equipment that need urgently. For example, in the ICU, yeah, one of the main equipment that they require is breathing. Yeah, the severe patient with COVID-19, they have problem with the breathing.
Okay.
And they need the support. And the machine is getting low, getting inadequate, not enough because of the number. So that is what we are going to buy. So we have, there were public donate the equipment. So, but because we have a connection with the hospital and the Sabah State Health Care Department, know which one is needed, still inadequate. So we will buy that. So
can the public
hopefully
donate
the
also
money,
in kind? If they are not donating money,
yes, they can donate in kind. So that's where the number of the equipment may reduce, but the most urgent one that still require, we will use our funding to buy. Yeah. So that is what our target.
Good, that's good. So maybe I think Datuk Chua also has initiated some exercise towards the end, after we've collected the money at the end of this show. Maybe Datuk Chua can give us a quick summary of how much is being raised for MMA. But this time I'd like to also start to introduce Dr. Timothy into the picture, the infectious disease physicians here in Gleneagles, Kota Kinabalu. The biggest problem now we have is, of course, it's COVID. So maybe Dr. Timothy, can you tell us how bad is this disease right now, and what is the situation out there in KK hospitals?
Okay, thank you very much, Elton. Now, when we say, I don't want to pass words, but when we say bad, I would define it as when there are too many people who are sick, and there is an inadequate ability of the healthcare system to cope. So when we say bad, that's what we mean, right? So at this moment in KK, in all the cities that have this huge number of COVIDs, the hospitals are full, and they're having great challenges in being able to get enough beds and places in the ICU to treat people who are becoming sick. And don't forget, we are relatively early in this surge of cases in Sabah. So if there are more and more cases in Sabah, then there'll be less and less places for the people who are sick to be able to be treated in the public health facilities. So that's the concern that all of us are having, and why we need to bring the numbers down.
Okay. So how is this disease right now in Sabah? I saw also in the news that Masidi announced there isn't enough, the hospital's capacity are up to 99% full already.
Yes. Now, let's go back to what the disease is. First of all, most people actually recover from COVID-19. All right. So I want to assure you, and this is based on facts, and not just so that you will feel better about yourself. Most people,
Will
especially those in
recover.
the younger age group below 60, usually have very mild to moderate symptoms, and they recover even without treatment. Okay, even without treatment, and many of them don't even need oxygen. But a certain percentage of people who get COVID will need to be admitted and have need oxygen while they are recovering. And out of that, a smaller percentage of them will need to be admitted to the ICU for close monitoring, also certain medications, and also higher levels of oxygen therapy. Uh, they may need high flow oxygen, the nasal cannula, and worst case scenario, they may actually need to be ventilated using a ventilator, which is a breathing machine. And the worst of it is, of course, when people die. Now, there are two sides of the coin for this disease. On one hand, you have a disease where you actually get better by yourself. You don't need to see a doctor. They just observe you. They give you oxygen as necessary. You go through 7 to 14 days and then you recover without any short-term or long-term effects. However, a percentage of people, if we're still trying to determine the percentage of people that are ill enough and need oxygen, it can range between 15 to 30% that will be sick enough to need oxygen. That means their lungs are already infected, and the air that they breathe does not contain enough oxygen to maintain the oxygen levels in the blood. So that's why they will need oxygen. So there are two sides of the coin. One is people get better on their own, and the other one, people get sick. Now, why is this frightening? Why is COVID frightening compared to, let's say, you get a bacterial infection, for instance. Let's say you have a pneumonia, a lung infection caused by a bacteria called Streptococcus pneumonia. That's a bacteria. We actually have the antibiotic to treat the disease. We give the antibiotic, you come to the hospital immediately, we give you the antibiotic, and then after that, you slowly get better because the antibiotic kills the bacteria. Now, what about COVID? COVID, like many viral diseases, and this not only for COVID, but COVID for any viral disease, when they cause a severe pneumonia, there is currently no medicine to give to kill the virus. You know, there's no medicine to give to kill the virus. I remember the bacteria infection, you got antibiotic. Go see the doctor give you something to kill the bacteria. But COVID, a person gets severely infected. There's no medication to kill the virus, antiviral therapy to kill the virus. So the virus then starts to multiply in the body and goes into the lungs and then cause all the complications. And the only defense that we have is our own immune system. So the idea is to support the body with oxygen when it needs and give time for the body using its own immune system to eradicate the virus. Now, going one step further, even after the virus is gone from the body's own reaction, the immune reaction to the virus, also causes most of the problem. You know, one is the virus causing problem, and the other one is the body's reaction to the virus causes problem. So the body's immune system comes and tries and kills the virus, and in the process of that sets a cascade of interactions and in the body, causing a cytokine storm that causes further damage to the lungs and also to the other organs such as the kidney, liver, and also may lead to other complications such as clotting defects in the body.
Right.
So that
So
is
there's
why
lots of complications that may happen after that.
Yeah. So again, the bottom line is why we worried if this is a disease that doctors do not have the medicine right now to kill the offending organism. which is the COVID-19 virus, the SARS-CoV-2 virus. We don't have a antiviral to kill it. So we are depending on your own immune system. I hope you all
So having said
understand
that, Doctor, what kind of tests are there in the market? Because I think now more and more people are getting infected, right? So a lot of people, their first reaction is to get themselves tested. But from my understanding, there are a couple of different kinds of tests. Perhaps you can share with us what kind of tests and what's the difference between them?
Okay. The first thing is regarding testing, right? Now, usually they take a swab from your nose and they put it right into your nasopharynx, or in people in the hospital, they actually use PCR sputum. And to detect the virus, they have PCR or antigen. I did not include that, antigen. I won't go into details about this, but PCR and antigen refers to certain parts of the virus that are directly detected by the test. So the two main tests that are available now is the real-time PCR or RT-PCR or rapid antigen test, rapid antigen. Now, the rapid antigen test can give you a result within 2 hours after testing, whereas a PCR test may take as long as 12 to 24 hours, depending on the ability of the lab to test, because there are thousands and thousands of tests coming up. So these are the two main tests that is available.
Which is more accurate?
Okay, the more accurate test is the PCR. Okay, the PCR. On the other hand, the rapid test antigen is good because it can give you the result within 2 hours, whereas the PCR takes 12 to 24 hours to come back. So the rapid test antigen is a screening method. Screening method where you need to test thousands and thousands of people, and you need the results fast, right? So if you use the rapid test antigen, it is negative. What it means that 85% of people who do the test and they get it negative, they can be sure it's negative. However, 15%, about 15% of people who take the rapid test antigen, it comes back as negative, but they actually may be positive.
Right.
You understand? So there's
a 15% discrepancy.
Yeah. So it misses out about 15% of the cases. So because of that, if someone has symptoms, allow me to go on quickly. If someone has symptoms, even if the test is negative, the RTK is antigen negative, I would advise them to do the RT-PCR test. All right? Or repeat the RTK antigen after a few days if they have symptoms.
Oh, okay. So where can people go and do the test here in KK? I think maybe some of the major hospitals they do it.
So all the hospitals do the test. All the hospitals in Sabah do the test. Private hospitals, and there are also labs and clinics that also do the test. It is actually available in the MOH website.
Right.
So in KK there are many labs. Many of them it won't be difficult to find out where they are. So what you do is you need to make an appointment. You need to make an appointment with any of these clinics or the hospitals that you want to do a test, and then you will go and do the test. Now, for the government clinics, they will do the test based on what is needed and following their guidelines. However, because of the sheer number of cases, if the public, they are worried and they want to do a test, even though they don't have any symptoms or contact, then they will have to go to a private center to get the test done.
Right. So I understand the Perkeso also are now paying for the test for all the corporates. If your companies, you subscribe to Perkeso, then you can also apply online to have the test done in BP. I believe the employer doesn't even have to pay for it. The Perkeso will cover for the cost of that. So I think if anyone interested, they can just go to the website. So speaking about hospital there, maybe one of MMA fundraising's aim today here is to provide for the frontliners and to provide also for the shortages in the hospitals. So maybe Dr. Kew, you can share with us with the fundraise, with the money raised, what is MMA going to do? What kind of equipment are you going to buy to supply to the hospitals for the time being?
What we do is we contacted the person in charge from the Sabah State Healthcare Department and also hospital to find out what is now still needed urgently. Yeah, as you say, a lot of people are donating kind and all those money. So actually, the federal government also provide million. Yeah, but then it had to be distributed for food and other things. Yeah, so what happened is, with the fund that we have, our priority is hospital because we are the doctors. We have to help the hospital to acquire the machine that they need to support the patient.
Right.
Other public, we leave it more to, non-medical also can help, food and everything. So protective equipment also we need. So we look at the machine. For example, if you look at on your right, that is what the high flow nasal cannula oxygen. Yeah, high FFNC, high flow nasal cannula oxygen, where for a person who like what Dr. Timothy said just now, the lung is damaged, infected, and they have difficulty to get enough oxygen to supply for the body need. So this machine will provide a flow of the oxygen into their lung so that they got enough to support. Yeah, so that they don't get lack of oxygen. There's still enough adequate oxygen for them to survive. So this is one of the machine that is lack at the moment. Okay, so that is where we're going to buy. And then you look at, can you go back to the last slide? And then we also have to protect the medical frontliner. Okay, because if they got sick, who is going to take care of the patient? So we have come up with this. These are because PPE is using everyday disposable and the expenses also very high. So for some of the doctors and all that, we can have this reusable respirator, so which can be used. And so what happened is the doctors who bought it, they have to pay 90 ringgit in order to get it, but MMA will subsidize 30 ringgit, one third of it. So they only pay 60 and we will pay 30 extra to the tender. So they have to register.
Dr. Kew, it looked like the Second World War, this chemical warfare, that you put on, something like that.
It's used.
Yeah.
Yes.
It's a biological warfare.
Yeah.
It helps to protect yourself. They are using the A&E and all that. Okay. So if there's a filter that they have to change. So if they use it with the non-COVID, then they can take about 2 to 4 weeks to change. But if they are in the COVID ward, they have to change every day, the filter. But so that is what happened. The filter can be changed. Okay, so this is one of the things that we offer to our medical frontliner. Okay, and then you can see the next slide, another machine. Yeah, this also another machine that to help to protect our doctors who in charge of the COVID-19 patient, specifically for COVID-19, which is called Power Air Purifying Respirator, PAPR. Again, it only can use for one person at one time. Okay, so we are increasing. This one is very needed at the moment. So we are going to buy another 20 properly. Yeah.
How much is one, Dr. Kew? Power Air Purifier Respirator. How much is it per set?
There is a price in one of the table. Let me check.
Yeah. Okay.
Yeah, I have the price. A few
So
thousand.
basically, I think like what Dr. Chua tried to initiate is, if people they don't want to donate money, they can always buy one of this equipment and donate it to the hospitals, right?
In kind.
Yes. Yes. And they can get tax exemption also if they buy in kind. Okay. There is a paper that there's a fill in, they can get it. Okay. So that is what the main thing that we are looking at the moment. Yeah.
All right.
Thank you, Dr. Kew. So we will constantly show, there are lots of people who have put in donations. We will show them in the figures down here that you can see. Meanwhile, we also show the bank account number for MMA if you are keen to donate again afterward. So meanwhile, I also heard, right, Datuk Chua, you also mentioned the other day there's vaccines coming out from China. So how true is it, Dr. Timothy, is there really a vaccine at this point in time that we can look forward to?
Okay, I think we can be hopeful because current technology, medical technology, and there are many groups of scientists that are working on a vaccine. So I would say we can be very hopeful that there will be a vaccine out soon.
Very
So
soon.
there's a lot of things on. I suppose everyone wants to know when will the vaccine be able to come out, or is there a vaccine available? To be honest, we cannot really answer this question. Science doesn't move like that. We just have to go by the evidence. So I'll just tell you what involves in getting the vaccine. First of all, they have to actually come up with a vaccine that can plausibly work. That means in theory can work. Then the next thing is they will have to test the vaccine on animals to see whether there's any adverse effects to animals, so animal testing. And then next, they will have the human testing of the vaccine. So initially, there'll be small groups of humans. They test to see whether there's any bad effects or side effects of the vaccine that is dangerous. If there is none, then they will test it on a larger group of people. That means a large group of people with the vaccine and large group of people without the vaccine. Now, the next question is, how long does this process normally take for other diseases where there's a vaccine? Even under the best case scenario, before a vaccine actually comes out in the market to be used, it takes about 1 to 2 years, minimum.
Wow.
All right, minimum. All right, minimum. The SARS vaccine, which is another coronavirus vaccine, that was out. I mean, the SARS disease was in 2003. We don't have a vaccine for that. The MERS-CoV, that was out in 2011, 2012. We still don't have a vaccine for that. We have had dengue for a long time. We still do not have a workable vaccine yet. There's one in the market, but it's not. So I just want to tell you the challenges of doing the vaccine. However, there's hope. Now there are many scientists and new technology and with more experience. So we can remain hopeful there will be a vaccine. Okay.
Right. Okay. So if there are no vaccine, then how are people being treated in hospitals?
Now this is very important. A vaccine is not to treat people who already got the disease. You mentioned if there's no vaccine, how to treat patients, right? Vaccine is not something to treat. It's something to reduce your risk of getting prevent. Now, what is better than a vaccine, and what if we don't have a vaccine? What we have is the mask. The mask that offers you protection because you want to prevent, and hygiene and social distancing. Because at the end of the day, you want to compare how these simple measures reduce your risk of getting infection compared to the vaccine, right? So we don't need to wait for a vaccine to prevent ourselves from getting this disease or reduce this chance of getting disease. We already have the tools now. Okay, we already have the tools now. So while awaiting for the vaccine, this is what we have, and this will work. All right.
What are the therapy now that's being used in the medical field? The COVID-19 therapy.
Okay, there are many therapies that are out. Now, the main therapy now in Malaysia is that if a person becomes very sick, these are the ones that have been tried, and all studies have shown that if there's insufficient evidence to recommend this to kill the virus, now what they use is dexamethasone. Dexamethasone is proven for those with severe COVID, moderate to severe COVID, needing oxygen, and they have pneumonia. The drug they use is a steroid called dexamethasone. Dexamethasone. So there's only one bullet that we have, dexamethasone, and we hope that it works. And other than the supportive therapy. So again, there's no COVID-19 specific therapy like an antibiotic that you give.
Yet. Okay. I think that's a very clear message that I think people should not also rush out there's a lot of rumors, I think, out there, kan, Datuk Chua. We saw some videos about people in China rushing to get their vaccines now. I think it's still a very early stage. So I'm sure there are probably some people trying to confuse the market. So be very, very careful on
Phase
that.
3, they call it vaccine phase 3. Actually,
Vaccine
they are supplying to Africa country or Middle East,
Right.
$2 US, you know,
Right.
to like guinea pig lah. But
Guinea pig.
whether you have any
Side effect.
the side effect, you have to, like what Dr. Timothy was saying, is you have to wait for 1 year later to find any side
Yeah.
effect. Yeah.
Yes, that's right.
Yeah.
Well, I've also heard a saying that, Dr. Timothy, that COVID may not kill you, but the fear of getting one will kill you. Now,
Anxiety.
I think anxiety, correct, is very, very real. Mental health is a big issue. In fact, our health minister also came out in the newspapers. We had a Chinese newspaper cutting. It says here they received 30 over 1,000 phone calls, and half of them are asking for mental health help in mental issues because of COVID, because of fear, because of depression. How should people cope with anxiety at this period?
Okay, I think the first thing is we need, and I presume I'll just reframe the question. So I presume these are people who do not have COVID, but who are worried about getting COVID. Okay, the anxiety
Right.
that you have because you
Anxiety, correct.
Okay, so
Stress
now
and anxiety.
so Dr. Q and me, we are actually doctors, so we actually see patients, and when we see patients, there's always a risk that they may have COVID. Isn't it? They may have COVID, and not only us, of course, many doctors and nurses face this every day, actually being in front of people who may have COVID. So how do you cope? I think the first thing is we need to know our facts well. Okay, the fact number one is this is a disease where for most people it is harmless. People do get better. So can you believe most people get better? Most people get better on their own. All right, so you don't need to worry. Second thing is, even if they do not get better, and even if they need to be admitted to the hospital, we have oxygen and other therapy, including dexamethasone if they get more ill, and then they can be treated. They can be treated, and still
Right.
most people actually get better from this disease. Now, what about the risk of death? Okay, what about the risk of death? Now, the risk of death can range from 0.1 to 1%, depending on what the condition of the people are. If you look at Singapore, very few people die, right?
Right.
And in Sabah, in many places, the places where people die, very often is people with multiple comorbidities. That means they have many other diseases as well that causes them to die. Of course, there's always the chance that a previously healthy person might die. But that is the same for every single disease. COVID is not the only disease that you can get, that you can die of, isn't it?
Yes,
so,
correct.
Now, a few practical things are how to cope with stress and anxiety. Now, take a break from the news, okay? Don't every day at 6 o'clock, 5:30, 6 o'clock, look at the news and start counting the number of cases. Today we got 100 cases, today we got 700 cases, 1,300. So your mood swings lah. In a higher number of cases, you get
Stress.
then you are stressed. I give you an example. What if I were to give you the number of accidents and deaths in Malaysia every day? Today 50 people died. Yesterday, the next day 70 people died. You'll be scared of going on the road, isn't it? Isn't it? Right? And if I were to give you the daily number of deaths for dengue in the world, the daily number of deaths because of heart attacks, the daily number of deaths because of tuberculosis and all that, then we'll be living in fear. You see?
Right.
So what I'm trying to say is that COVID is one of the diseases that we face. All right? Just one of the diseases. I can see people, they're scared of COVID, but they're still smoking. They're not scared of lung cancer, but they're scared of smoking. Right? Now, actually, they're more likely to die of a
And in
heart
fact,
attack.
the recovery rate for COVID is quite high, isn't it?
Yeah. So if you are a smoker, I just give you an example. So if you are a smoker, and you're afraid of COVID, you're actually more likely to die of a heart attack or a stroke or lung cancer than COVID. You know, in fact, if you smoke and get COVID, it's even worse. You see? So we need to put things in perspective. Can you put the slide up again so I can just go through the slide? Okay. Now, sorry, the previous one. Now, get regular exercise, eat healthy food. Now, obesity, if your weight is very high, that is a risk factor for severe COVID. Okay, so a person is very overweight, that's a risk factor of getting severe COVID. Now, try and find some activities that you can enjoy. Stay in touch with your family and friends. This is a very stressful period because we cannot meet one another. People can't go to church, people can't go to the mosque, people can't go to the temples, they can't go and yamcha with their friends, they can't go and visit their parents, their brothers, their sisters, and all that. So this puts people under a lot of stress. So the social support for any stressful condition is not there, right? And you all know Zoom, the way we talk, is good, but it doesn't replace social interaction. But nevertheless, just realize that this is not a permanent situation. Okay, COVID-19 is not the first disease to affect humans. Okay, it's not the first pandemic. We have survived many pandemics. All right, so stay in touch with family and friends, and also be prepared and do what you can to lower your risk. There's no point worrying, right? Just lower your risk of getting an infection, and that's quite simple. Wear a mask, social distance.
Just follow SOP.
Yeah, what? Okay, you think about it. It's not easy to get COVID, isn't it? You wear a mask, you hand hygiene, and social distance. You just stay in your room, you won't get COVID, what? Isn't
Correct.
it? If you go out, you don't meet people, you come back, you won't get COVID. If you go out, you meet people for a while, you stay 6 feet away from them, and you wear a mask, and you come back home, you're not going to get COVID, isn't it? By the way, some people, they think when they go out already, they're going to get COVID. You see? No one. All right.
That's true.
So what is it? I mean, I'm not a psychologist, so I'm just trying to tell people that know the facts of the disease and don't be scared. Okay, I'll give you another example. Why people are scared. One person get COVID in a shopping center. Just one fella. The whole people in the shopping center think they may have COVID from that one person. You know, without this is unnecessary fear, you know.
Well, it happened in KL, remember? You know, they screened through the entire shopping mall, all the staffs and the guests.
One shop got one person with COVID, and the whole block of shops, people are scared to go. You know, this is unnecessary fear. You know, unnecessary.
Dr. Kew, do you come across very stressful and very fearful people like that also, Dr. Kew?
Yes, we do have. I mean, some people are paranoid. But this happened. So it's not easy to change the personality. So we just had to give them the advice. That's all we can do. And another thing is, some of them may need the psychiatry support or psychologist, counselor, to help them. Another thing is like dengue. You got dengue, you can get the post-dengue, you can get depression. I'm not sure about COVID-19. Okay, but dengue definitely. It can got the post-dengue depression. So this can happen also. Because a lot of factor. And then again, another is social dilemma. I mean, people, when you got it, it's like, wow, everybody is scared of you. You know, you feel like this is a stigmata. I got COVID-19, and that will also make you depressed. And stay alone also is a risk factor. Another thing I would advise is those who have the hypertension, diabetes, who have some kidney disease, require dialysis. All this will try to do the proper SOP and try to reduce or going out, because they are the one who get it very badly. Okay. And then if they have their children, the children have to be careful. Don't bring it back to the elderly. If you're the elderly parent, those are my advice.
Correct. We actually have a question here asking, when a COVID patient has recovered, is there a risk of him passing on the virus to the others? Any comments from either Dr. Kew or Dr. Timothy? If a COVID patient has recovered, has come back
No,
from
he
the
won't.
hospital.
He won't spread it to anyone else. All right, that's the short answer. So you don't need to worry, and please don't
Don't
stigmatize
scare.
the person. Don't stigmatize the person.
You already
Right.
developed the antibody. Yeah? When you got the disease, you develop the antibody,
In fact, he's
which
the
kill
most
off the
safest
antigen.
person. He's the most safest to be around with. Actually,
Yeah.
The
If
safest.
he's more
everybody
safer
got
to be around
infected,
him.
if everybody got infected by the COVID-19, then that's it. No more worry. Yeah. The flame already stopped. It won't fire anymore. The problem is
Correct.
those who just get it without recovery yet. They are the one infected. The flame is still there. They can pass over.
Correct.
Yeah.
So the big question also, there's a lot of rumors out there, saying that there's natural therapies, lemon water, salt water, or even the heat from the sun can kill COVID. What do you guys have to say about this? Either maybe Dr. Timothy or Dr. Kew, or even Dr. Chua, do you believe that the salt water or heat from the sun can kill the virus?
If it did, it can do. I think we will not have 41 million cases, positive cases.
Correct.
Another question I think is more. Yeah. Sorry.
No, I think this refers to disinfectants on surfaces. Okay, not salt water, disinfectants on surfaces, not for the body. If you want to disinfect your table or this and that, then they will kill all the viruses that are on it. Okay, obviously, we know that we shouldn't drink bleach and all that. This thing came out because people, CNN and all, they wanted to score some points against the person they hate the most, Donald Trump.
Yes.
And started bringing this up as if he suggested that people take bleach. He never did that. Neither did anyone else. So I think most reasonable. Everyone knows that it doesn't, it doesn't.
Okay.
Now coming to
we
salt
have a
water.
last question here also.
Coming to salt water now. It is a common practice for many people. You got sore throat, you gargle with salt water, isn't it? When you go, then the doctor says gargle with salt water, gargle with Listerine, this and that. Would that reduce the chance of if you have COVID, will that kill the COVID virus and hence prevent? Will something like that prevent people from spreading the virus at least? Actually speaking, there are some studies being carried out, to reduce the transmissibility of virus using certain types of disinfectant gargles. There are studies going on right now. Okay, so it may not be saving people, but it may theoretically prevent the virus from being spread. Okay.
Okay. So, having said that, we're looking at now lots of lockdown, and even our lockdown is being extended into November. So economic-wise, I think it's a big impact to Sabah, such a small community, such a small city. Datuk Chua, you are an entrepreneur, you're a businessman. How do you see this will impact the local economy?
I think it's a strike balance between the COVID-19 and the economy. Provided the state and federal government are stable, we do not have any emergency things come in and whatnot. I heard some rumors saying that tomorrow the rural conference will decide on that. Okay, put it aside. You can see the red color that we have on the short of cash, turnover, bankruptcy, which a lot of airlines are facing bankruptcy, and the traditional business eliminated, and then drop in revenue because of COVID, and global economic recession because of COVID. So my suggestion is we to have the table stable. You need the four legs to support the table. Table is the economy. So basically, we have to learn to live with the COVID. It's not so easy to get rid of this COVID because it's a viruses like the SARS, MERS, which Dr. Timothy has shared with us. You cannot get rid of it, let's say tomorrow, and vaccine, and then just get rid of it. It's not easy. We have to live with it. We have to strike a balance. You have to strike a balance between this virus and the economy. So basically, all this traditional business that they are doing, you have to invent certain innovative ideas. And then if you actually can use online that we are doing now, so much better. And then also you have to more specialize in your business. And I think if you refer to the last session that we have on the 7th opportunity after new norm, we actually share something on that. And then under the PUMM, Datuk George Lim also share some on this. You can look at some of the in July, which we have actually shared to the public. So to sum it up, basically, we have to be using a new business modeling, contend with the COVID-19 together. So this one is to move ahead with all these things. We cannot just get rid of it like that. It's not so easy. So facing all these new challenges, and by entrepreneur, we must learn how to survive. The best thing is actually wage subsidy is one of them, and then the government must be stable. Yeah, over to you, Els.
Okay, thank you, Dr. Chua. We just take one final question because we've overshot our time. There's a I think I'll just click on it, right? Anyway, I think it's for Dr. Timothy is asking, are we overreacting with the measures taken by the government? So, I think with the current situation.
You mean, is the government overreacting or we overreacting? I think I'll answer.
I think the government is overreacting.
It's a very broad question. It's very difficult to answer a question like that, because if you do not act, then people say you do not act. If you act too much, then people say you're overreacting, isn't it? So how do you balance? That's why that is the reason why we really need a committee not only comprised of doctors, but people like Datuk Chua and all sections of the in society. Not only doctors, I tell you, if we leave it to doctors, then all of us will be staying at home and not going to work, right? True or not? I mean, Datuk Chua, you're a developer. I'll just do a developer. Whenever workers go up to build buildings, there's always a risk that they may fall and die, but you take the necessary precautions to reduce the risk, right?
Yeah.
Reduce the risk. Whenever a fisherman goes out to fish, there's always a risk that there may be a storm and they may not make it, right? But they always take the precautions. They listen to the weather forecast and all that, and then they take necessary precautions not to happen, but they don't go. So we don't tell the fishermen, hey, don't go and work, don't go to the sea because you might die there. I don't want to go to fish. Never mind, you also don't go. You see. So my view is that when everything settles, not now, maybe down the line, if you are worried and you don't want to go and work and you want to lock yourself down, you lock yourself down. But don't prevent other people from going to work. That is what I would define as overreaction. That means imposing your fears upon other people. All right. You are very scared, you want to make other people scared also, right? That's a difference between what we are doing. We are not making people scared, but we are giving people information on how to be safe. So as coming back to the question on the government, I think the government is not overreacting. The government is giving information on what to do, the healthcare. Now, overreaction, I don't want to go into the politics of it, declaring emergency and all that, that's a separate thing. But I would like to see more reaction. We would like to see more reaction in building services in Sabah. We would like to see more hospitals, more doctors, more equipment, which is why we're having today's forum, because we are not overreacting. We do not have enough equipment. We do not have enough staff to treat people in Sabah who are sick, and also to protect the healthcare workers who are taking care of them. So in that sense, we're not reacting well enough. We're not reacting well. but we are overreacting on other things that are not necessary. You see, don't overreact on things not necessary, but underreact on things that are necessary. Right? So I hope that answers the question. Huh?
Okay, Ken. Okay, I think we leave the last slide here to the public is the hotline numbers where people can call for information. If you can very quickly just put out these numbers here. And we will be ending our session very, very soon. A big thank you to Dr. Timothy, Dr. Kew, and also Datuk Chua. Datuk Chua, would you like to have any final closing?
Okay, I actually look at the numbers that we have just now. Under the Sharida group, we have a total 40,000.
That's all the donations being collected.
Committed, yes, committed.
Yes.
And then the basic group, we have about 25,000. So today's session, we from the public, I don't know whether they will be coming in to Dr. Q's later, the next few days. And from our commitment here, Sharida group and the basic group, we managed to raise 40,000 plus 25,000, 65,000 today, which is not too bad.
That's very good. That's very good. So that's all this money will be going to MMA.
Thank you very much.
Yeah. All right, that's great. So I think that's all for today. So thank you everyone for joining.
So the last one, Elson, may I make a promotion that maybe on the 11th of November,
we're going 11th of November.
Talk about the high-rise properties. And tonight is a special edition. We just talked about COVID-19. There's nothing about properties. So on
fundraising.
On the 11th of November, we'll go back to the property again. We'll talk about special subject on high-rise. Okay, see you on the 11th November.
See you on 11th November. So thank you, Dr. Q.
Thank you, everybody. Thank you.
Thank you, everyone, for making a donation. So please support Sabahan frontliners. Okay, thank you so much.
Thank you.
Thank you.